Today, I am pouring and sipping, well, it was poured, and now I'm sipping on a drink called Golden Dee. It's very delicious. And with today's topic, please grab a drink that you love so you can sit down and embrace what I'm about to tell you. All right, let's get started, peeps. What is 340B? What is it, okay? It was created by Congress in 1992 to help low-income, uninsured, and otherwise vulnerable patients gain better access to prescription medications. Prescription drug manufacturers provide discounted medicines to certain clinics and hospitals, otherwise known as covered entities, sometimes as low as a penny. You heard what I said? They get as low as a penny. Today, corporate players are profiting off a program meant for the poor. And this is what I spoke about when we don't watch our elected officials. We don't pay attention, right? We put them in office and we don't, pay attention to what they do. And trust me, they don't want you there. They don't want you at these meetings because they don't want you to know what's going on. So you're not hurting them when you don't show up. So that's what I'm saying. It's no badgering. It's just hoping that you're enlightened to, what we need to do to help take care of our pocketbooks, right? So here we go. If you don't know, you don't know. That's why I'm here. Today, corporate players are profiting off a program meant for the poor. Covered entities, nonprofit 340B hospitals, and massive health systems. Contract pharmacies. The pharmacies the 340 hospitals contract with to dispense medicines. Third party for property entity public benefit managers that act as intermediaries between health plans, employers, and chain pharmacies that own contract pharmacy locations. How do hospitals now abuse this 340B? Let me go right step by step how they do it, okay? Follow along. Big hospitals enroll in the program, right? Often exploiting loose rules to claim eligibility. They purchase drugs at deeply discounted 340B prices. They purchase a drug. They prescribe 340B drugs to all patients, even those with insurance. They administer 340B drugs in-house or through external for-profit pharmacies. Despite purchasing drugs at 340B discounted prices, hospitals charge patients the full rate. Embrace what I'm telling you. They might buy, like they said, those drugs for a penny. And that's what the program is for them to do. But they're supposed to give it to you at a discount price. But they're charging you full price rates that they didn't even pay for. So they're making massive profits, right? Big hospitals, PBMs, and for-profit pharmacies pocket the profits. So something that taxpayers have given to the government to be ordered to do this 340B discount rates for pharmacies, for prescription drugs from pharmacies, are actually not reaching the very people the bill was created to help, right? So this is another way that big businesses are exploiting the common American worker. So we can stop these things once we know they're happening, right? So this is why I'm telling you they're happening, so you can spread the word so we can fight this type of legislation. Because when we fight, Americans win. When we gather, when we get together and clean together, and because we are the people, we are the voice. That's what our Constitution was created for, because it says we the people. However, we cannot organize and maintain and fight when we are not aware of what's happening, right? So this is what Sips and Sips is doing for you, okay? How much are hospitals marking up drugs? Now sit down and sip. Get you some of this Golden Dee, or you had a previous episode was this, so every new episode you drink for the next episode, right? This recipe would definitely be in the caption. How much are hospitals marketing up drugs? Patients are paying 10 to 20 times more for prescription drugs as a result of hospital markups. For example, one study showed Michigan hospitals inflating drug prices by 800%. I didn't say 80. I didn't say 100. I said 800% or more compared to what hospitals actually pay for the drug. Another study showed a hospital paid $1 for a commonly used medication and charged the patient $3,000. Who pays the price when this occurs? Patients pay more without seeing any benefits. Patients often pay based on the original price, not the lower 340B price that the actual hospital received, right? While hospitals pocket the difference, leading to higher out-of-pocket costs. Okay, high premiums, dues, and costs for union members. Rising costs forces union members to increase premiums, get their premiums and dues, benefits, and make difficult choices between employer spending for a worker, health benefit, pensions, and wages. Okay, goes up for the employer. The employer has to make a decision on what kind of packages and plans to negotiate to give to you, right? Or offer you. If you're a union or non-union worker, right? American workers. Hospitals shift focus away from vulnerable communities. Hospitals prioritize expanding service to wealthier areas, sometimes closing clinics or eliminating critical services in low-income areas, leaving undeserved communities with reduced access to care. Self-funded plans lose manufacturer rebates. Prescriptions filled at the 340B price often aren't eligible for rebates and discounts. This leaves unions paying the full original price and foregoing valuable rebates that reduce costs, okay? Independent providers and pharmacies get squeezed out. Them little small pharmacies, what we call, independent employing businesses. And we always try to what? Patronize small businesses, but they get squeezed out under this plan. Hospitals steer prescriptions too large. Retail contract pharmacies forcing independent providers out and limiting patients' access to personalized care. What happens in the states? Across the country, state lawmakers are introducing bills that give big hospitals and PBMs more control over drug discounts intended for patients in need. These bills are known as contract pharmacy mandates and sometimes wear deceiving titles like Protect Drug Affordability Act, but they expand corporations' access to the 350B savings, with no guarantee those savings reach vulnerable communities which it was entitled. And they don't fix the underlying problems in the program. Today, 87% of the $81 billion in the program is controlled by hospitals. Let me repeat that. 87% of the $81 billion in the program is controlled by hospitals. What's going on in your Pacific state? Right now, it's different. It's going across the state, but here's the 5 states that's right immediately doing with legislation, right? Georgia is called HB 139, In-House Health Committee. Washington State, SB Senate Bill 5981, Ways and Means hearing. That already happened on February 5th. Please look up and see how it went down. HB 2145, a pressure hearing, that was on February 6th. Please look in your state and see what was also that hearing. New York, Senate Bill 1913 is called Joint Hearing for Health and Medicaid. That occurred on February 5th, so get the results. Michigan, it's called HB, which is House Bill 4878 in Rules Committee. Virginia, Senate Bill 278 in Finance and Appropriations will likely be referred to the Subcommittee on Health on February 5th. Now, today, of course, we're going into March, so you have a chance to look back in those what occurred then and where it's not at now in the states of Georgia, Washington, New York, and Virginia. Michigan, where is in the Rules Committee. So we were hearing like April or May. So we want you to know in your state so you can follow these bills and see what's going on. Write your House or Senate where it's at and let them know how you strongly disagree with these changes. 3 steps you can take. Contact your lawmakers. That's what they're there for, right? You actually pay their salaries literally with your taxes. Reach out to lawmakers you know and or lawmakers sitting on relevant committees. Ask them to oppose this bill. Okay? Testimony. Organize and sign letter from state-based members of or allies in different community groups you are in and ask them to oppose this bill. Author an opiate or submit a letter to the editor, your local paper, and raise awareness about the problems with this bill. Raise this in your churches, community organizations, neighborhoods, neighborhood block program. Let people know what's actually going on. Okay, we can fight this. The reason why Sips Civics exist is let you know you have power. That when people say, what can I do? I'm here to educate you, to let you know what you can do. First, I got to let you know what's going on, right? Can't act if you don't know what's going on. And once you know what's going on, you have the power. Again, let me repeat, the Constitution starts with we the people. So embrace your power. And once you have knowledge, you have confidence. And then once you know the avenues that you can take to enhance that power, to make that power be effective. Because one thing I wanted to understand, I want you to be effective in fighting for your rights and things that you are entitled to. But you can't fight if you don't know about it, right? So this is what I want you to understand. And please understand that what's going on, how they are taking something, falsifying. These hospitals are falsifying eligibilities in some cases for the 340B program. And like I said, they'll buy something for $5 and charge you $3,000 for that same drug. Okay, we're talking about drugs at high blood pressure, diabetes, inhalers, breathing, all type of medications that we all need as Americans, and sometimes, in some instances, to sustain our life. Okay? So this is what we do here in this space to bring awareness and let you know. And you can, of course, anything I give you, I always tell people, I'm giving you this information, but you have accessibility to look it up, and so you could, I just want to break it down. I want you to go somewhere where we use these big words and stuff. So I try like I said, break down history, current events, and politics in this space. So thank you for joining me today. I hope you get this recipe and utilize it at any event, social event, or when you sit down here talking with me. This is Golden Dee. Totally delicious. Until next time, peeps, Andrea.